Fibromyalgia is not easy to diagnose. There's not any specific blood test that we can say, aha, there it is. So we have to really use that as a diagnosis of exclusion. We have to figure out what it's not to really analyze what it is. There is a good correlation, a strong correlation between hypothyroid and fibromyalgia. Fibromyalgia is really a group of symptoms that is more of a general diagnosis. But patients who have fibromyalgia very often have a thyroid condition. Other conditions that may influence fibromyalgia would be things like a leaky gut, things like having blood sugar imbalances, things like having adrenal dysfunction. Adrenal glands are directly tied into stress, and many fibromyalgia patients have numerous stressors. Stress can come from three different areas. It can come from physical stress, it can be psychological stress, as well as chemical stress. So we have to look at all those different stressors to analyze how much stress the patient is under. We treat patients in a holistic manner by looking at not only their physical makeup, but their metabolic makeup, as well as any other psychological stressors that they may be under. So we get a full picture of what their metabolism is undergoing. Trigger points are knots or nodules that are found within the myofascial coverings of a muscle. They can give rise to pain, lack of motion, and a referral pattern. That referral pattern can give us pain or dysfunction from an area distal or further away from the actual trigger point. Looking at it means we'll run certain specific tests. We'll give patients certain questionnaires, that standardized questionnaires that help us analyze how their body is functioning. Putting those two pieces of information together along with an examination really gives us a window of what's going on. Just for instance, blood pressure is a real common test that all doctors do. But if we do blood pressure both sitting and have the patient immediately stand up, take their blood pressure again, normally it should raise. On a patient who has adrenal dysfunction, it will stay the same or actually decrease, which is a functional test for adrenal imbalance, which indirectly can relate to fibromyalgia. Specifically for fibromyalgia, we have to treat, again, what are the underlying causes that maybe contribute to this patient's group of symptoms. So we have to look at and analyze the entire patient. We have to look at their digestive system. We have to look at the thyroid. We have to look at the adrenal glands. We have to look at the gut to really analyze what are some of the contributing factors to the fibromyalgia.